All right, good morning and welcome to MWG Senior Services short tutorial video on Medicare Advantage and Medicare Supplements. We're going to be kind of going over the differences to be able to help those who aren't in the Medicare market 100% of the time be able to stay updated with a good bird's eye view of how these plans work. So let's go ahead and get started. First of all, these are very different plans. Medicare Supplements are also known as Medigap policies. Medicare Advantage plans are also known as Part C. They do completely different things. If you go into regulation, Medicare Advantage plan regulations is extremely strict, and they will throw you under the jail if you mess up. Medicare Supplements is much more lax. There's not the CMS is not kind of providing oversight of every individual agent as well, and they're not on the insurance company's back to make sure everything is always 100% proper and handled in the time frames that they want. We'll go into that more deeply. I'm all about things being structured, making sure the seniors are protected, but at the same time, some of the things they do make it very difficult to sell and make it tougher on the individual as well. And there are some main coverage differences. So what we're going to do is go over Medicare Advantage first, then Medicare Supplement second. I'm trying to get this wrapped up between 5 to 10 minutes. You can watch some of our other training videos for agents here on MedSupBroker.com, on YouTube. It's on our Medigap Broker channel. If you want to watch direct to consumers to see what people are telling consumers, go to Medicare Finders on YouTube or MedicareInsuranceFinders.com, and you can access some different videos and training information that'll be able to help what you can tell consumers. And there's about 25 to 30 videos on that site talking about how to reduce premiums, a lot of different things out there that could help you as well. But this is strictly from a broker standpoint what we're doing today. Okay, Medicare Advantages. They take over the Part A and Part B administration for Medicare. So basically, Medicare is no longer handling the claims portion or the administration. That is the private insurance company. It's called Part C. There's also Part D, so there's Medicare Part A, B, C, and D. But Part C and Part D are both sold by private insurance companies. D is the drug coverage. You must be certified to sell these plans. You have to be AHIP certified, which just pretty much is it's just a kind of, you spend a day taking certification stuff, but just about. You can do it online. You have to go through the ins and outs, learn about Medicare Advantage plans, the laws, the rules, how they were set up, and then you have to do a carrier-specific plan. Plans vary by state, even by county within a state in a Medicare Advantage plan. So you may have a Humana plan or an AARP plan or United Healthcare plan somewhere in your state. You may have 10 different plans, but it can't be sold. But one plan can only be sold in maybe 8 counties and not the rest of the state. So things do vary, and Medicare Advantage plans can include Part D coverage. In those situations, it's called an MAPD, Medicare Advantage Prescription Drug Plan. All right, Medicare Advantage plans. There are providers in the network. That's this is the excuse me. Let me say that differently. Providers in the network is the biggest difference between Medicare Advantage and Medicare Supplements. Medicare Supplements, you can see any doctor, any hospital that you want that accepts Medicare. Medicare Advantage plans, there's HMOs, there's PPOs, there's private fee-for-service plans, there's SNPs plans, Medicare Savings. There's a lot of different plans out there. They all have different networks you can or can't go into. Maybe you get good benefits if you go to these, or how you still can go see these doctors, but it's less coverage. There's a lot of different options there on the Medicare Advantage plan, so just to throw that out there to you. Premiums are low most of the time on Medicare Advantage plans. That's basically that's it in a nutshell. That's why they are the popular plan right now, is because their premiums are low. They're similar to a group health plan in some aspects. That's what I like to compare them to. You have deductibles, co-pays. Every year you get the deductibles. If you get in a health situation, you're not going to be able to go to a Medicare Supplement once you're in a Medicare Advantage plan and you're unhealthy, unless that Medicare Advantage plan pulls out of the state. AHIP certification for agents, I should have said this on the last one, but it must be completed annually. It's not a one-time deal. Low-income individuals statistically like Medicare Supplement plans better than Medicare Advantage plans. However, if their income is $22,000 a year or lower, they're more likely to enroll in a Medicare Advantage plan. You can find some more information about this at MedicareInsuranceFinders.com/blog. Put the website there on the screen, as you can see. It's just a good little piece of information about that. Applications. Kind of talk about some of the rules with this, just so you know. Applications are submitted to the insurance company within, I said 24 hours. It's actually 48 hours of enrollment. I know it says 24 right there. Excuse me. I don't know why I did that, but they must be submitted quickly. And you also have to have a scope of appointment form signed 48 hours prior to the meeting. So you have to actually mail them something or send it to them by email, or if they're a walk-in client, so if they come to your office, they see you, they see your building, oh, they offer Medicare products, they can come in and they can say, hey, I want to talk about a Medicare Advantage plan. You can say a walk-in, you can do it that way. An agent cannot cold call for Medicare Advantage or Part D plans. Someone calls you, you can talk to them about it, but you still need a scope of appointment form, even if they call you. If your secretary says, hey, I need you to call my mom about this Medicare Advantage plan, you're not allowed to call her. Her mom has to call you. It's very strict marketing rules with it. I don't hate Medicare Advantage plans. I realize there's a market for them, but the compliance and regulation, stuff like that, it gets very frustrating to have to deal with. And yeah, so-and-so wants to know why you hadn't called them. Well, I can't call them. Why not? Just give them a call. You can't do it. If you do it, and somehow it gets back to there's secret shoppers out there in Medicare trying to see if people mess up. They're coming to presentations. They're doing a lot of different things. So watch out if you're doing that. Make sure you follow the rules to a T. Scope of appointment form must be submitted with the application. Now let's roll over to a Medicare supplement. Again, I'm just kind of going over the basics of these plans just to kind of say from an agent standpoint, if you want details on plans, go to MedicareInsuranceFinders.com. Medicare supplement overview, it's not a part of Medicare. The plans, not parts, but plans A through N are sold by private insurance companies. Plan F is the most popular plan, and you must be a licensed and appointed agent to be able to sell these, but you do not have to be certified. These plans are also standardized, so on a Medicare Advantage plan, how you can have different plans across the state with the company. A Plan F is with Mutual of Omaha is the same Plan F in 47 states, and then is the same as the AARP or whoever, Blue Cross Blue Shield's Plan F. They're all the same. Plans were standardized in 1992 and they changed in 2010 under the Medicare Modernization Act. What it did, you may be familiar with the Plan J. It was the big popular plan there for a while. It was better than the Plan F. It provides some extra benefits, but unfortunately those benefits were never used. So due to underutilization, they ended up doing away with EHI and J actually. So they got rid of those plans. And then they brought in some new ones. The Plan N's a good plan. They brought it in. It's got a $20 copayment each time you go to the doctor. No Part B deductible, and it doesn't cover excess charges. And the plans are much less expensive. And if your client wants something less expensive, doesn't mind paying deductibles, it's a great plan because of it's so much less expensive. Medicare Supplement plans. You can enroll anytime during the year. I don't know why I said this on this slide. I was trying to type it up quick for this. But Medicare Advantage plans, you can only enroll certain times of the year. Medicare Supplement plans, you can enroll anytime during the year. I duplicated the slide. That's why it was. No networks. Do they accept Medicare? All your client has to do is say, do they accept Medicare? Does the doctor, does the hospital, does it accept Medicare? If it does, they can go to that Medicare. They can go to that provider with their Medicare supplement. They don't have to check networks before they go. Rates are usually about $100 a month for the Plan F, again, which is the most popular plan. Some places like Connecticut, the rates are higher. They're up to like $250 a month up there. Starting out, they're community age, so they have some different rules up there than most states. Rates receive on average an 8% increase per year. That's not uncommon. A lot of times it's more than that. Just to give you a heads up, there's some companies that are out there that have rates that are so high and they give like a 1% increase, so they're averaged in there. But health questions are asked if you are outside of a guaranteed issue or open enrollment period. You can apply year-round. See, that's where I messed up on the slides. I duplicated the slide earlier. I apologize. So again, Medicare Advantage plans, you can only enroll during certain time periods. In Medicare Supplements, you can enroll year-round. Now, if you want to get a Medicare Supplement quote, that's what MedSupBroker.com is for. Some of the things we do, if you contract with us, we allow you to have the Medicare Supplement quota, the system, the marketing tools, all the different things that come with it. However, you must be contracted with us. The new carriers come out in that state. If you want to have them added to your quote engine, you need to get appointed with us. We don't cut your commissions. We take a 1-point override in most cases, but we provide you with a lot of cool tools, and we write business ourselves. So we build these tools for us and just want to provide them to you as well. We're not in it to try to rake you over the coals or anything, but we think these tools are really cool and we provide them to other brokers because of how much they help. So this is kind of an example of what some of the quote engines that look like on your website. You see medsupbroker.com is where you can go. Step 1, this is how you would apply to get your information. The height and weight it's mandatory, but it's not. We put it on there because in some states the height and weight charts with the United of Omaha and some other companies out there were important. But fill in the thing and you get the different rates to pull up. Here's an example. It pulls it by your monthly bank draft amount. You can sort it by other ways, but it pulls by the monthly bank draft for order of top to bottom. So we have about 25 to 30 Medicare Supplement carriers on the system. And it is a great system to use if you're a broker, marketing tools, links. You can just put them in newsletters, all different types of things. So both plans provide benefits to specific people. Let me say this again. Medicare Advantage plans, if you got an individual who's never sick, never goes to the doctor, never goes to the hospital, he has money. And he doesn't mind paying a little bit out of pocket. A lot of times those Medicare Advantage plans will have out of pockets about $6,000. Most people can't afford that. That's another reason why I like Medicare Supplement. But if they got money and they don't mind taking the risk on that, that's perfectly fine. If they develop cancer, they don't mind paying $6,000 a year, so there's no different Medicare Advantage plan, that's perfectly fine. Medicare Supplements are designed for people who want a fixed cost each month. They want to know I can pay X amount and I don't have to pay anything else. It does great for seniors with budgets who actually follow their budgets. It's a great plan. Medicare Advantage plans have higher regulation than Medicare Supplement plans, as we mentioned earlier. Premiums are lower for Medicare Advantage plans and are more like a group health plan. Where Medicare Supplements I always give the analogy of they're kind of like the fair. You go and you remember there's that one night where you could buy the wristband and you could ride all the rides for $20. And so it's the same thing with Medicare Supplement. You pay your premium, you can ride all the rides for free. So that is the basics of what we wanted to present today. Again, you go to Medicare Supplement, medsupbroker.com. This is our Medicare training presented by MWG Senior Services. We thank you for watching, and if we can be of any help or assistance, please don't hesitate to give us a call. Our number is 800-800-1397, option 6. Thank you very much.